CoreNet is a community of practice. We've been in existence since May 2020, and really the intention was to foster exchange and collaboration among all of you researchers. At the moment, we stand at 60 plus organizations. We convene over email and Slack. If you don't have access to Slack, just send me a message and I'd be happy to share the link with you. We've been organizing coffee hours, ethics dialogues, and earlier on in this year, we conducted the CoreNet conference. At the moment, we're also putting together content for the CoreNet newsletter, as I had personally emailed to many of you. So if there's anything that you'd like to share with the community, these could be project-related requirements that you may have at the moment, an event or reports based on past events or future announcements, a tool or resource that you may have developed and would be useful to share with the community, or a blog post or a thought piece, please share them with us by early next week, by mid next week, and we'd be sure to add that into the upcoming newsletter. Coffee hour sessions, as you know, are informal conversations, usually scheduled on Thursdays, but this one on Friday, to really share among the community members the new work that's been emerging. And today we're really pleased to have with us Alka Malhotra. Alka Malhotra currently works as a communication for development specialist with UNICEF India in Delhi. She spearheaded communication strategies on child rights issues and led communication researches, and has advocated for institutionalizing of communication processes at the national level. She's also led entertainment, education, and media-based innovation programs for UNICEF India, including the popular TV soap opera Kyunki Jeena Isi Ka Naam Hai, Meena Ki Duniya, etc. And also the Transmedia Initiative for Adolescents, Aadha Full, which comprised of a TV and radio series, a mobile game, and an interpersonal communication toolkit. Since the COVID-19 pandemic, she has led monitoring and evaluation for risk communication and community engagement interventions for COVID-19, designing several rounds of U-report assessment, community-based monitoring, CAB surveillance, and community rapid assessments across several states. And with that, I'd like to kindly pass it on to Alka. You have co-host access, Alka, so you should be able to share your screen and take it from there.
Thank you so much. And thank you for providing this opportunity to share these very important findings that we have just completed for one of the for what we are all currently dealing with, and what CoreNet is all about, which is the COVID response. So I'm going to share with you. Can you see my screen?
Yes, we can.
I think I'm going to go off camera because I am taking this on through a hotspot, and I don't want to at any point compromise on net. So I'm going to go off screen, off camera, if that's okay with all of you. And let me just speak to the slides. So basically, the community rapid assessment, as we called it, is based on the behavioral drivers model, which says that we are all compelled to behave in a certain way because of our knowledge, because of our coping strategies, our trust in, as well as the information and communication that we all get. And based on this model, we actually went ahead and structured this particular assessment, which is currently, I'm going to share with you the findings from 5 states, UP, Bihar, Madhya Pradesh, Odisha, and Andhra. And we have now extended this to 10 states. So it will give us a little bit of a wider canvas in the next round, where we will be having data from 10 states. We have designed this as a time series. So we've completed round 1 in April, just as the second wave was subsiding. And the first round was in April, and the second round was completed in August, early September. So the methodology is that we have a direct contact with random population in these 7 states, 5 states that we have covered. It is a random digit dialing method by which we just, the system throws up a random number, which is a 10-digit number, and then you call up the the telephone number, and if the person responds from the other end, we have a few screening questions which keep them online, which include them in the survey or not. And these are basically, we have a quota for women, so we have to have at least 50% respondents as women. And then we have some questions on urban or rural, and that's how the how it proceeds. These are computer aided telephonic interviews, so there is a person that the respondent is speaking to at the end of the line, and that is really the case. We have quotas, as I said, for urban and rural, men and women, and we also included in our study, besides the general population, people from community platforms that UNICEF has been engaging with, which is panchayat members, self-help groups, and frontline workers. I will not be presenting a lot of that data because that was really to help us define the way that we are working. So here are the four modules of this of the behavioral drivers model: the communication, information, and trust in information, the coping strategies, the behaviors and drivers, and the effectiveness. And we had objectives around these. The effectiveness part of it, I will not really speak to because this is a wider audience, and that data was more for UNICEF to identify areas of improvement within the way that we are working. The profile of the general population over the two rounds, as you would see, is almost similar, except the age distribution in round two, where we found a larger percentage of younger population at about 29% in the 40 to 44 years, and we did not have a lot of respondents from the older age group of 40 to 50 years of age. This was only in the second round. Because this is randomized, we really, that's the way it threw up, and we did not have a quota for age. Moving forward, the next couple of slides, I'm going to focus on the findings related to the vaccine, which is really the main issue that we are all grappling with. And the later part of my presentation, I will speak about coping strategies as well as return to services aspect of the findings. So when it comes to the COVID vaccine, our question in round one, because at that time in April, we had not really opened up vaccination for the younger population. So the question was, do you intend to take the vaccine? And we had a very high intention of respondents to take the vaccine. As you would notice, yes is at about 74% for the general population, except for the frontline workers, where about a large percentage, 58%, had already taken the vaccine, because vaccination opened up for this audience much earlier in the year, actually from January. So this is what we found, that SHGs, PRIs had a high intention of taking the vaccine, and frontline workers had actually taken the vaccine. When we moved further into this intention in round one, and we see whether people have taken the vaccine or not, we find that 48% have actually had one dose and 24% have taken both the doses of the vaccine. So that really reassures us communicators that people have moved from an intention onto practice of actually adopting the behavior. And if you look at the states, this is highest in Andhra Pradesh as per our findings. So what we wanted to find out a bit more about was the status of the general population, this 48%. The question that we had to ourselves was, what is the 8% that says that they do not intend to take the vaccine? Where are they, and how would they like to proceed further? So here we find that this 8% actually is, where are they? They are in rural areas. 60% of the population that says that they do not want to take the vaccine are indeed in rural areas. 54% of them are women. That's again something about taking the vaccine and who they are. 32% of them are from the SCS, from the SC population, and they are the most excluded groups. And then again, we have another data set to tell us that they are those who have not had any education. So the percentage of respondents who have not had any education are the ones who need the focus, telling us again that when we want to promote vaccines, we really need to reach out to the most excluded parts of the country. And in terms of age, also, we need to reach out to these groups. Now, when we asked about the reasons for taking vaccines among general population, we find that the fear of getting COVID is about 42% of the general respondents saying that that is the reason that they would take the vaccine, and 34% of them saying that they would take it because it prevents you from getting seriously ill. This is reassuring again because it reconfirms the fact that people are concerned and a high risk perception would lead to vaccine uptake. At the same time, there is this second blue green box that I would like us to focus on, which is because everybody is taking the vaccine. So one of the reasons, one of the drivers, as we know very well, for vaccination will be at some point in time, people who will take the vaccine because everybody's taking it. And I think that is something that we would like to also look at as we move forward. And I think the country is already doing that with this 100 crore people who have taken the vaccine. Reasons for not taking the vaccine. So we found out about the population that is not taking the vaccine. We know where they are, and we have a sense of how to reach them, where to reach them. But what are the reasons that they would not take? In the first round, we did not have a lot of people who said that they want to wait and see. But in the second round, we have this 49% urban and 32% rural population that is saying that they want to wait and watch. The concern for side effects has dropped, so we do not have to worry about side effects. But at the same time, there is this point about wanting to wait and see what. If you're not concerned about the side effects, then what do you want to wait and see? The disease. So these are some of the areas. These are probably emerging hesitancies that may be coming up. For not being able to take the vaccine, we also wanted to find out a little bit more about other non-communication related factors. And the larger ones in them are this whole thing about non-availability of vaccines, which is higher in, which was reported higher by more number of women than men. And at the same time, we also have other communication related issues, such as I have a limited understanding of the registration system. I do not know where the vaccination center is. And if we actually go deeper into this other issue, then we are also seeing that I'm not sure about what documents I need to carry, which has implications for us as communicators. So while the infrastructure related issues are around non-availability of vaccines and non-availability of a center nearby, the information related issues around vaccination requirements and documentation continue to persist. So key takeaways from just the vaccination part of this entire exercise is that, as we know, a large percentage has taken at least one dose, and then there are 24% that at that time when we completed the study in September had taken both doses. The profile of those who are not willing to take the doses are those who live in rural areas, are coming from scheduled castes, are women, have had no schooling, and are among either the 18 to 24-year-olds or the above 40 to 44-year-olds. So then when it comes to hesitancy, there is this issue of wanting to wait and see, and yet then there are decline in concerns about side effects. When it comes to normative drivers, we know that soon normative drivers will be important as part of the diffusion of innovations curve. There is this large majority that will take it because everybody's taking it, and that is something as communicators we must be aware of. Infrastructural issues and non-availability, while that is true, there is also issues of incomplete information about the process of getting registration and getting vaccinated. So that's the story around vaccination. Now, if we move to information, I'll take a pause here. Are we good? You can hear me?
Yes, Alka, we can hear
Okay,
you.
great.
So
So I'll just move on then. So let's get down to the other three aspects of the behavioral drivers model, which is information, communication, trust in institutions. Now, when we ask question around trust, I don't think there is an issue here. So we know that there is a high trust in government institutions, and this has increased over the rounds. So increase in trust, we see an 89% from an 85% increase in trust on information being provided, and increase in trust on what the government is doing to prevent, to promote the vaccine. So there's which is great. That's the first starting point. When it comes to trust in the effort being made to control the epidemic or control the pandemic, we're again seeing that overall the trust in government is high, and we see some of the states not showing this high level of trust. But between the two rounds, the level of trust has definitely increased. So there is an 86 in AP versus a 92 in UP in terms of trust. But if you look at the trend, it is definitely an increase towards the positive, and in none of the states do we see a drop when it comes to trust. Moving forward, if we just look at the trust by background characteristics of the population, especially the general population members, we are seeing that the trust has increased overall. It has increased for the general population. It has not increased. I mean, it's increased overall, but when it comes to education, there is a trend of increase by age group. There is a higher trust among the older population versus the middle age, which is the 30 to 34 years of age. That's where the trust has kind of dropped. It has increased between men and women, and definitely between the urban and rural areas. So the degree of trust has gone up generally, except for population by age group. Which community group do you generally trust? If you look at the degree of trust, okay, one is the trust in government, which is fine. Next, among the community groups that you would trust, community groups such as local government and local youth group are the ones that are high. Now, the other point over here is there is a 37% respondent that is saying that they do not trust anybody in round one, but in round two, we did not get a single respondent that said that they do not trust anybody. So, which is again, overall trend showing that there is a positive trend towards trust. Trust in local health providers is high, and it has sharply increased since round one, and probably understandably because of the way that the vaccination drive has been going and the way things were going, because round one was immediately after the second wave, and at that point in time we were grappling with managing the situation. Round two was September, October, so it's positive on that trend. Now, when it comes to information sources, we find that overall television is the highest source of information. It was at a 77 in round one, down to a 74 in round two. The trust in television in round one was at a 56. It's down to a 52 in round two. But overall, definitely television is higher. The drop is there, but not much. But the drop in social media, this is rather high, from a 42 to a 35, and the trust from a 13 to a 12. And among these common sources on social media, it's Facebook, which is the highest, followed by WhatsApp, YouTube, and the others. Something for us to consider. The other point that we want to actually say is, among the other sources of information, friends and family, etc., come out fine. But when it comes to other sources of information, we are finding that radio, surprisingly, has emerged over here as at a 6.4% of the respondents saying that they listen to radio as a trusted source of information. Have you received information in the past week? Generally, yes, the information received over the past week has been high, though we do see a lower trend than round one. So round one, 18% had received some information, 27% moderate amount of information, and 35% a lot. We see that trend somewhat changed to a 31, 16, and 26%. So a lot of information has gone down, and who have heard nothing has gone up. So clearly, as we move towards normalcy, the amount of information on COVID in the past week, it has been generally declining. Now I'm going to go a little bit fast because I realize it's already 4:30. So when it comes to behaviors and drivers, what we see is that do you think that you are likely to be infected when it comes to the risk perception of the general population? It has generally gone down between round one and round two, because I suppose the number of cases have gone down and so on. So this individual low risk perception is generally down, but it's gone up in the case of Andhra Pradesh and Odisha, where we see an upward trend. Maybe the number of cases there were going up. Individual risk perception by trust. So if you trusted the government, then you're also likely to trust the vaccine that the government provides, and therefore you're more likely, your individual risk perception was significantly higher among those who trusted the government, so they went ahead and took the government, the vaccine, or are likely to take the vaccine. When individual risk perception, when we look at it from a vaccine status point of view, we do not see much of a correlation here. So we do see this correlation when it comes to trust and individual risk perception. We do not see a correlation when we talk about individual risk perception and vaccination. Maybe at that point in time, those who had a high individual risk perception were not necessarily, we did not see any correlation to their vaccine status. So what would you do to protect yourself? We do see hand washing continuing to stay at a high. There is a drop in wearing the mask in public places from a 62 to a 52%. There is a general increase in staying away from a 35% to a 37%, and increase avoiding handshakes, etc., has gone up. There is staying at home has gone down because people have really started opening up and going to work. So did you follow behaviors in the last 1 week? We find that 67% of the population said that they followed masking, 55 said that they followed social distancing, and only a 45 said that they actually maintained distancing. So that is something, avoided social gatherings. So this is about going out for parties and marriages and all of these other opening ups that had started towards September, October. And so hand washing continues to stay But when it comes to avoiding social gatherings, people are less likely to do so. Now, when it comes to coping strategies, here I'm going to focus on healthcare provision and Anganwadi centers for nutrition and preschool services. We find that people do not generally see a barrier in accessing any of these services. So while in the first round there was a 36% that said that they had no barriers, it's down to 36% that had no response. Here, this is where we see that the no problems have indeed gone up because centers have opened up. And when it comes similarly to what am I saying? It has gone up because, yeah, people are, the centers have opened up, but people are not necessarily accessing the services. And the reasons that they are giving for not accessing the services are, I'm not satisfied with the service, the facility or the provider is away from home, and I am afraid that I may contact infection. So this is the trend that we see, that they are 47% are facing a problem in going and accessing healthcare, and 16% feel that they expose themselves to infection if they go and access healthcare. While when it comes to Anganwadi centers, we find that Anganwadi centers, the access to Anganwadi centers, people do not perceive a problem there. It was at a 62% in round one, which has dropped to a 43% in round two, but they are afraid to access and get infected. So this 18% is pretty high across both services, whether it's healthcare provision or it's the Anganwadi center. How confident are you that when you need, you are able to protect your family? People are quite confident between round one and round two, but there is a drop. So in round one, 68% were quite confident. In round two, 52% say that they are quite confident in providing for masks and soaps, etc. And the hardest thing that you had to do, and here is where we are seeing this younger population reflecting the fact that their colleges were closed or they were unable to access educational services. There is also this large percentage of 11% that said that they had to look for work because they had lost their work. So this is clearly the trend that we are seeing, that there is the impact of COVID on livelihoods, and that is causing them to feel less confident in providing for masks, soaps, etc., required to protect the family. So self-efficacy is high, yet in the last 30 days, they have faced bothersome issues. And then this trend is higher in Andhra Pradesh, where people are more worried about accessing services. The other part that we wanted to just touch about here was about schools, and we find that more parents reported to sending their schools across all respondent categories. And we, of course, have the comparator with frontline workers. So we see that a higher percentage of frontline workers are not sending their children to school compared to the general population, or at least that's the trend. Are your children engaged in learning? The SHGs, PRIs, FLWs have access to these facilities as compared to the general population, where we found only 61% engaged in learning compared to among the frontline workers. They were able to provide online means for their children to be learning. And this is not the case in Bihar, because in Bihar we do see a change that fewer respondents actually said that their children were accessing learning. Similarly, we see this difference between a 72% in urban areas versus a 57% in rural areas, where children are not accessing learning because there was remote learning happening at the time. As I said, this is planned, and we are already going into the new 5 states next month. So we will see a different trend when we do the next round. So in some, there is a high trust in government, high trust in the information that the government provides, and a lot of people have heard lower information about COVID in the next round, which is in September, October versus round one. The risk perception is lower. So overall, there is a decline in risk perception, and there is a steep decline in UP and Bihar. People who trust the government have a higher risk perception, and vaccine uptake is definitely not correlated. At this point in time, when we did this study, we did not see a correlation between vaccine uptake and risk perception. We know that certain behaviors are followed. Hand washing is almost self-reported behavior, and people continue to say that they do wash their hands. On masking and avoiding social gatherings, we see a different trend where there is a decline in practice. When it comes to coping strategies, we find lower self-efficacy because of closures, because people need to seek work. There are no major barriers to accessing essential services, but people are concerned about the risk of infection when they go for health centers or Anganwadi centers. And they are quite worried about the effect of the pandemic affecting them over the two rounds, but it has declined over round two. And access to information and access to education is 61% among the general population, but it's much lower in Bihar. So that's it for now. Thank you so much for your patient hearing, and I'm happy to respond to any questions or clarifications that you may have.
Great. Thanks so much, Alka. This was really useful and also very interesting because, I mean, clearly it seems like this is new information that we are learning here that helps us revisit some of our older sort of notions, I guess, and preconditioning around how we thought vaccines, both uptake and hesitancy were sort of panning out. I see a lot of coordinate members here in the community also are doing work on this topic already. I have one question, but I will first invite Sophia from IDFC Institute to kindly share. Please unmute yourself. Yes, great. Hi, Sophia.
Hi, thanks, Olga, for the presentation. That was very insightful. I have two questions for you. So the first one is this gender gap we're seeing with women less, willing to get vaccinated. And it's actually the opposite of what we're seeing in many other countries. In Europe and the US, it's quite the opposite, with women having, higher vaccination rates. So what are your, explanations on what we're seeing this trend when especially women are already in charge of routine immunization? So, we could assume they're more familiar with vaccination and might be more willing to take it because they're used to doing it for their children. My second question is on ventilation. I mean, we've known for a while that ventilation is one of, the most important appropriate behavior that, can help prevent transmission, and yet we don't talk about it too much. Is it something that, didn't come up at all in the survey, or did some people, included that as one of their preventative behaviors that they try to put in place? Is it something that you would consider maybe asking for your upcoming surveys?
Shall I go, Rohan? Yeah, okay, thanks. So good questions, Sophia. On the first one, on women's uptake, what we found, and it was a disturbing trend right from January 2021, when we did the formative study to really understand drivers for vaccines. So we wanted to understand a little bit about that, and we did a 5-state formative study. And in that formative study, at that point in time also, it came out pretty high that there was what's the word? It's not hesitancy. It's there isn't a compelling reason for women to get vaccinated, if I can put it like that. It was more around the fact that women generally do not go outdoors. In India, they tend to be, and it's associated with gender norms, and that they tend to stay indoors. So their likelihood of exposure is lower, so they can be the second ones to get vaccinated. That was what came out of the formative study. And that is what we see in the uptake for vaccines also. So if you go into the COVID app and you look at the uptake for vaccines, you do see a disaggregation, and you see a lower uptake for women. So it is very high for frontline workers because they are the health workforce comprises of women. So there we do see 80–90% women taking the vaccine. But when it comes to general population, women, we are not seeing enough numbers of vaccination. And there are other barriers such as lower health seeking behaviors for women, lower gender norms, of course, driving all of that, and also issues of security, transportation, access to digital, because initially when it started off, it was about digitally registering yourself. So access to digital spaces is lower for women. So we did see those trends, and it kind of goes with that. On the second question around ventilation, it did not come up as a spontaneous response. And I think that's also because it's not among the 13 behaviors being promoted for prevention, it is not promoted enough. So perhaps that's why it's not top of mind and it did not come up as one of the responses. And these are post-coded questions. So we ask the question and we post-code whatever is the spontaneous response. So it did not emerge. Even in the others, and I can go back and check, but I don't think it is, ventilation is there as much. Thanks. I hope that answers your questions.
Great. Anyone else who has a question or a thought? Varsha, over to Varsha. Hey, Varsha works with Savita, but maybe Varsha, if you can introduce yourself, please.
So, hi, Alka. I work with Savita, which focuses on improving uptake of routine immunization, and we're using a couple of nudges, SMS reminders directly to parents, and something called local influencers/ambassadors, which we got excited about after JPAL's research a couple of years ago, led by Abhijit Banerjee, Esther Duflo, and others, which found that identifying local influencers in a systematic way and sending them reminders is potentially more effective and cost effective in getting more parents to uptake routine immunization. So at the moment, work is focused only on routine immunization, but we are closely following COVID vaccination uptake and trying to see if there is a role for some of our nudges or not. We're still on the fence on it and are hoping JPAL would tell us one way or the other. So thank you so much for your presentation. I agree with Rohan and Sophia. It was really insightful. And I have to say, some of the previous research that at least I've come across have focused more on Facebook and other social media as a source of information, and the fact that UNICEF and this research is focused more on direct phone calls. I guess in some ways it gives me more confidence in some of the results, maybe, or it seems it could be potentially more comprehensive. I guess one question was if there was anything, you mentioned women, was there anything around pregnant women as a cohort that was studied separately, and anything around vaccine hesitancy there? And the other was more of a clarification question. You mentioned something around higher trust in government and higher risk perception. And I wasn't really clear on the correlation and why that exists, or if you had any insights in that.
So we had, so this was a survey, randomized digit dial with the general population. We had a quota for women, but we did not ask about pregnancy status. Good point. We will introduce a little bit of if you're a woman, yes, are you pregnant by any chance? I mean, but then we'll have to follow married, not married, and all of these other questions. We'll see how much that is possible. But we definitely consider that. So we don't have any, specific questions around pregnancy and hesitancy. No. we do have some information on that from some of the formatives or qualitative studies that we have done, but not in this particular one. So your second question was around correlation. So we found that if you had a high trust in government, you were more likely to what's the exact sorry, if you had a high trust in government, you had a higher risk perception. So those who had a higher risk perception had a higher trust in government. But those who had a higher trust in government were not necessarily vaccinated. We did not see a trend there. We could not. At this point in time, we could not. Maybe for the next round, when we do that analysis, we'll be able to see. So a higher risk perception, definitely a higher trust in government, but a higher risk perception, meaning vaccinated, not sure.
Thank you. Varsha, do you have another question? Or? Okay, cool. Yeah, this piece around the correlation was also something I had in mind. So thank you for asking that, Varsha. Maybe one question I had was around social gatherings, Alka. And I mean, this is something that I noticed, and I just wanted to know if there was a way to build this into the survey, and also because it's something that I read. But how, particularly around Diwali, for example, people ended up going to each other's homes, and while they would say that they were masking and they were hand washing, etc., there was still very high contact, particularly around festivals, right, or any sort of thing, with people that you were already related to or in contact with, etc., right? So there was this notion of like inside and outside, in the way that I will not do public gatherings or social events, which meant contacting strangers, but still people are meeting each other if they have kinship or relationship. And I wonder how, if you notice that, if the questions registered that, and how would one address that?
Yeah. So what we found was that there was a downward trend in avoiding social gatherings, as in wedding. First of all, this was before Diwali. It was we finished our data collection by end of September. So we are, a month before Diwali. So I don't think the festivities had hit the conscious mind by the time we finished the assessment. So that's one. But there was a specific question around going out for gatherings, because one of the things that came up, and this came specifically to us from our Maharashtra office, where we realized that people had started going out for weddings and other social celebrations. So there was a specific question around avoiding social gatherings. And we did not see, people were, we found between round one and round two that the number of people saying that they actually reduced going out in numbers or going out for social gatherings had gone down, which is true, which is what we saw. We saw that more people were going out and that more people were actually getting together and gathering. And also there were questions around staying at home as opposed to going for work. Again, there was a negative. So people in round two said that they were going for work, they were not staying at home, and they were going for regular activities outside of the house. The only thing that we found a positive trend on is, and again, it's self-reported, so I can't say, is about avoiding handshake and physical contact. Maybe that's true. Maybe people do avoid handshake and physical contact, because that we found that between round one and round two, there was a positive trend. More people were saying that they avoided handshakes and physical contact as compared to the first round.
Thank you. Are there any other questions in the room?
I see something on the chat box. Let me just see.
Yes, right. So firstly, Shekhar writes that 48.6% of vaccinated beneficiaries are females, according to CoWIN app, which is not a major gap, and the gap is narrowing. Women are already higher than 50% in Bihar, for instance. Um, and Shekhar says we would take the lack of correlation between individual risk perception. Um, oh, right. Maybe Shekhar, if I can invite
Should
you
I
to
voice
please.
over?
Yes,
Yes,
please. Yes.
yes.
Yeah,
Thanks.
thanks, Alka, for this really insightful presentation. A lot of interesting data points. I was wondering about the lack of correlation between individual risk perception and the vaccination status. And if I interpret it, I think it's a positive because you're moving away from individual responsibility and riding on high risk perception, which we know is low now, given the lack of numbers of COVID, to a more of a norm. Everybody's doing it, so might as well do it. Sorry, my dog's in the background and growling again, growling. So hopefully you can hear me.
Yeah.
That was my question.
Yeah, and you're absolutely right, because we also see this trend, and I those green boxes that I had. So while people there is a large number of people who are responding to say that it is actually I would be vaccinated because everybody's vaccinated or because my family is vaccinated. So I think it's a good, and as communicators, and I keep coming back to us as communicators, it is something that we should piggyback on. We should be promoting vaccination for all. It is protection for all, so that it's this normative move for everybody to be vaccinated. Great.
Right. So just to follow up, Alka, so is there also then communication suites that you're designing on top of this, on just the evidence? Like how has the communication strategy been changing? If you could give us some sense of that within the UNICEF.
So there are two aspects to this that we find out. One is the where, and the second is the what. So the where, definitely we found pockets of that 8% of the non-vaccinated not intending to take vaccination. Where are they situated? What is the profile? How do we reach out to them? That's the where. So the where of the communication, we are constantly tweaking, and in the 5 states where the study was done, we are looking at how to reach out to these buckets of lack of vaccination, if I can put it like that, almost. And the second is the what of communication. So the what, again, is more around everybody's doing it, the promotion around the social aspects of it. So that as we develop our community, and I think all of the content that came out as preparation for festivities was that while you prepare for festivities in a normative manner, you also normatively go for vaccination, normatively follow the COVID appropriate behavior. So the way that we are in UNICEF are using this is on both sides. The focus where the women, the most excluded, the age buckets that are showing hesitancy or the starts of hesitancy, and the what of communication. How do we tweak our content to respond to what we are finding out from the evidence? I have one question here, I think.
Yes. There's a question from Shyama, which I'm going to read out. So Shyama says, you've mentioned that there were no major barriers in accessing care, but they were concerned about the risk of infection. So do you find anything more about, did you find anything more about whether people restricted seeking care or prolonged services?
So the question that we had was not really about restricting seeking care, but I think what we asked was, would you take up services as they open up? So people have generally said yes, they would, but there is a caveat of the risk of infection. And I think this goes back to the what of communication. So to say that, and more so for schools and Anganwadi centers and healthcare providers, as we open up services, to reassure people that it's safe to come back to services. So that's something that we've taken on as in the content of our communication. We definitely speak to the fact that as services open up, those services are safe for accessing, because those who are providing those services are following COVID protocols or prevention protocols. If we could, keep that communication going, because somewhere this risk perception that I can get infected if I go and take up services is emerging in our evidence. Absolutely, continuous communication and continuous communication, responding to what we are finding from the research is really key, because it's about I may have questions which I may not ask, but if you're already answering the questions which are in my head because you found them in the data that you have sought, I think that would be great.
Right. So indeed, like the rising percent of people who didn't hear anything in the past few weeks is alarming, and we should create an environment where more and more people just have, keep COVID at the back of our heads, right? And not.
Yeah. And I think that also goes to the fact that how we are communicating around COVID. It's initially we were communicating about the risk. There was a lot of news. Now the number of cases that have dropped. So, the general communication about the pandemic is lower. But we need to continue communicating, because there are other issues that may be right now not so latent, just because the number of cases have dropped, but we still need to continue to communicate about prevention, about vaccination, and these aspects. Absolutely.
Indeed. Shama, would you like to ask this question?
Yeah, I'm actually not unmuting because my son is actually creating a lot of ruckus here. So sorry about that, Alka.
No
thank you for the excellent insights. Thank you so much. I just wanted to ask, because you mentioned a couple of things, right? And now you're saying that this communication is very important. And I represent Swasti. It's an NGO based out of Bangalore. So we are very involved in, providing this awareness communication and continuous messaging to communities till we reach that make sure that, the last mile populations have been vaccinated. So would you say that we need to amp up our efforts in rural areas and especially do like targeted communication as well as vaccination for women, since that is something that is very strongly coming out from your study also?
I would say yes. Focus on rural, focus on women, focus on even among the women and the rural, the SCSTs. It came out in the evidence that, this is the group, the pockets that there isn't enough information. Listen to them, talk about uptake of services, because there is a little bit of a hesitancy to uptake services. People are scared that they may just get infected. Yes, so there is a need to focus on that. And it's very important to talk about adhering to COVID appropriate behaviors, even if the number of cases are dropping. It's not over till it's over. So I think that's the communication that we need to keep alive.
Great. Thanks so much for this. We're at time, and at this point, I'd like to thank Alka for taking the time and sharing these interesting insights as well as these actions with us. I thank all of you to taken the time to join this session. In case if you have any questions or thoughts to follow this up, please write to us. My email address is rohan@quicksand.co.in. We're at the moment also putting together just evidence based off of all the research that you've shared with us, to put together a small deck on just how understanding how vaccine uptake and hesitancy has changed over the past months. So in case if any of you attendees have any recent sort of studies that you'd like us to see, please send them our way, and we'd be very grateful. Again, thank you so much, Alka. Thank you, everyone. We'll be sharing a recording with everyone soon. Thank you.
Thank you. Thanks a ton. Bye.
Bye.
Bye.